This station is for BVM Apneic. I'm going to talk about a couple things, how to set up your station before we begin the demo. So I highly recommend that you have your BVM on the opposite side of your suction. Reason being, a lot of times I see students get this tubing all wrapped up, becomes a tangled mess, and then you're fighting it. Okay, so just put it off on one side or the other, okay, but separate. Also, you're going to have kind of an array of OPAs or NPAs or both. I would kind of just grab them, go ahead and size them real quick, see which one's going to work for your patient. And I'm going to keep this one in front of me. The other ones I'm going to push off to the side. So I know exactly which OPA I'm going to go for. Next thing is to check off your suction. You need to know exactly where the on-off switch is. Okay? Again, a lot of times I see students not check that off, and then they're looking all over the place for an on switch and just wasting time, and they don't look super competent in their skill. Okay? Another thing I want to talk about with suction here is there's a lot of stuff that I do that I'm not necessarily going to verbalize. You can if you want, but it's going to be a mouthful of stuff. So when we turn it on, I would turn it on here, and I'm going to check my suction on a gloved hand. I should hear it suctioning, okay? Now I'm going to insert as far as I can see without suction. I'm going to apply suction, and I'm going to suction out in a sweeping motion for no more than 15 seconds. Don't forget to turn your suction off when you're done. At this point, I would go ahead and continue with my OPA, my ventilations. Now, once I clear my airway, I have 30 seconds to get my OPA, size it, insert it, and initiate ventilations. Okay, 30 seconds to do that. When I'm done ventilating on room air and I go to switch over to my oxygen, once I stop ventilating, I have another 30 seconds to hook this up and get back to ventilation. So my patient should never go more than 30 seconds without a breath. Okay, and of course, don't forget to check a pulse at the very end. We always want to make sure that our patient is still alive and that they have not gone into cardiac arrest while we've been ventilating. Okay, so with that, I am ready to begin my skill. BSI, scene safety.
Scene is safe.
Hey, are you okay?
No response.
Call ALS and transport, and then let me know. I'm going to go ahead and do a head tilt chin lift. I'm going to look, listen, feel, check for a pulse simultaneously. Any signs of life?
The patient is unresponsive, apneic, and has a weak pulse of 60.
Copy that. He's not breathing but has a pulse. So I get a head tilt chin lift. Do I have any fluid inside?
There's blood in the mouth.
Okay, I'm going to go ahead and suction. I'm going to have no suction on the way in. As far as I can see, no more than 15 seconds. Am I clear?
The mouth is clear.
I'm going to grab my OPA, proper size, upside down, flip it. Does he accept it?
The patient accepts.
And then I'm going to go ahead and start ventilating my patient on room air. I'm looking for good rise and fall of the chest, no difficulty bagging.
The patient is being ventilated adequately.
Okay, copy that. I'm going to go ahead and hook up to my O2. It's on. I'm going to check my pressure. Go to 15 liters per minute. Reopen my airway and initiate ventilations with high flow O2, 15 liters per minute, one breath every 5 to 6 seconds. And I'm going to go ahead and confirm that I still have a pulse.
The patient still has a pulse.
Okay, that concludes my skill.